Hey, I'm Dr. Carr. I'm one of the second-year ER residents at Brookdale, and today we're going to go over a FAST exam, which stands for Focused Assessment Using Sonography in Trauma. So today we're just going to go over what the technique is, what the areas you're supposed to look at, and then what each area is supposed to look at if it's normal. Okay? So today we're going to use the Zanari, and we're going to use our curvilinear probe, which is good for distance. And the first spot we're going to go to is called the subxiphoid space. And I like to start there just because if someone has hypotension and they have a pericardial effusion, it's usually something that you can take care of right away with a needle decompression. So what we're going to do is you're going to always make sure the probe marker is to the patient's right or your left, and you're going to go in the subxiphoid space. And you're going to do is you're going to push down, and you're going to make sure that you see all four chambers of the heart with the liver in view. And then you're going to sweep through. So what we want to look for is all four chambers of the heart with interface with the liver, and the most important area is right between the liver and the right ventricle, and you're looking for free fluid. And you want to scan through, and in this case we don't see any free fluid. Okay. So after the subxiphoid space, the next area you want to check is the right upper quadrant, or Morrison's pouch. Again, you want the probe marker towards the patient's head or your left, and you're going to go right where the liver and the kidney interface is. And what we want to do is we want to make sure there's no free fluid between the liver and the kidney, and then we also want to make sure that we get the inferior pole of the kidney and also the liver tip, which is the most sensitive area in a FAST exam. We'll look for fluid between the liver and the kidney interface, and again, you want to make sure that you get the inferior pole of the kidney and also the liver tip. Like we said, the liver tip is the most sensitive area for free fluid in the abdomen. Also, if you're having some trouble with the rib shadows, you can always tilt the probe about 30 degrees in line with the ribs, and it gets rid of a lot of the shadows, and then you can scan through. In this case, it's normal. The next spot you want to look at is the left upper quadrant, or the kidney and spleen interface. What you want to do is you want to make sure your knuckles are down towards the bed, and you want to try to go as posterior as possible. And the most important areas to look at are where the spleen and the kidney come together, and also above the spleen, which the most sensitive area for that is actually the interface between the diaphragm and the spleen, and you want to scan through. So this is the view you want to get for the left upper quadrant. Again, we want to look for the interface between the spleen and the kidney, and you want to scan through, making sure you get the inferior pole of the kidney, and also what's more important is actually the interface between the diaphragm and the spleen, which is the most sensitive area on the left upper quadrant for free fluid. Alright, the next spot and the last spot is the pelvis. So what you want to do is you want to make sure, again, your probe markers to the patient's right or your left. You want to go directly above the pubic symphysis, and you want to aim down looking for the bladder. A lot of times your depth is going to be too high, so you want to decrease your depth so you get a good view. And you're looking for free fluid behind the bladder or in the pouch of Douglas in women, and you want to scan all the way through, looking for free fluid in one plane, and then you want to turn 90 degrees and make sure you scan in the other plane. Generally, fluid that's inside of a normal structure like the bladder will be nice and smooth corners, and if you see free fluid, it generally has sharp corners. In the pelvis view, again, you want to look directly above this pubic symphysis and aim downwards looking for the bladder, and you want to do is you want to scan all the way through looking for free fluid behind the bladder in two planes. You want to turn 90 degrees, make sure your bladder's in view, and you want to scan from side to side, again looking for free fluid. And like we said, free fluid will generally have sharp corners, where fluid inside of a structure such as the bladder will have nice and smooth rounded edges. And you want to scan all the way through. Okay, those are the four areas of the FAST exam. As a quick recap, we have the subxiphoid area looking for free fluid around the right ventricle. You have the right upper quadrant looking for free fluid between the liver and the kidney. You have the left upper quadrant looking for free fluid between the spleen and the kidney, or between the spleen and the diaphragm. And then you also have the pelvis looking for free fluid behind the bladder or in front of the bladder. So the next thing we're going to talk about is the EFAST, or extended fast. The traditional thing is to do just lung views looking for either pneumothorax or pleural effusions. Now, the extended view could be interpreted as you can do any other ultrasounds such as the aorta or the IVC, but today we'll just stick with the lung views and how to do them. So you're going to do one on each side. You're going to do the most anterior view, because if there's a pneumothorax, that's where your air is going to rise to. And you want to do is have your probe marker going towards the head of the patient, and you want to look for 2 rib spaces, and you want to look for the pleura, which should be right between them, and you want to look to see if you see lung sliding. Now, when we zoom in, I'll show you the different ways to tell if there is lung sliding or not. So this is the view that you want to look for lung sliding. We have 2 rib spaces, and we have the pleural line right between it. Things to look for is actually seeing the pleura moving, which you do here. Other things to look for if you don't see the pleura moving is for anything called B lines, which are linear lines that go through the A lines, which are the horizontal lines. Any line that goes straight all the way down is considered a B line, which you do see occasionally here. The other thing you can do is put on M mode, and you want the line to go directly through the pleura. And the thing we're looking for is what's called the sandy beach, what looks like waves crashing on a beach, which means that you do not have a pneumothorax. Other things that you can look for is something called a lung point, where you actually have a piece of the lung that will not be moving, and then a piece of the lung that will be moving, and that is 100% specific for a pneumothorax. Another thing you can do with ultrasound, especially with abdominal trauma, is pregnant females. Coming in, you want to make sure you do a good ultrasound of the uterus and look for a good fetal movement, look for a good fetal heart rate, and look for any other signs of free fluid in the abdomen, such as actually free fluid between the placenta and the uterus interface. Other uses for ultrasound and trauma are such things as looking for the IVC and using that to determine what type of shock the patient's in, which the most common shock in trauma is obviously hypovolemic. Other things you can use it for procedures, such as pericardiocentesis if you have a tamponade, making sure that your needle's in the right place, and also that make sure that you don't injure the myocardium itself during the procedure. Other things you can also use it for is obviously IV-guided central lines and IV-guided peripheral lines if you're having difficulty during the trauma itself. One last thing that you can use if you do a lung view during the EFAST and you see a pneumothorax, after you place the chest tube, if you don't have an X-ray immediately available, you can redo your lung views and make sure that you get lung sliding back, knowing that your chest tube is in the right place.